Hello, I'm Andrew with Vata, and today I'm going to go over our Seymour models, our 910 and our 920. These are two of our most popular wound care items. And today I want to touch on three different things for you guys. I want to just kind of go over generally what is on the model, the different wounds that are present on it. I want to go over how the models are used, what we hear from our customers, whether they are in a hospital setting or they're industry customers. And then at the end, I want to touch on some of the frequently asked questions we get, and that will include kind of use and care of the product. So like I said, this is our Seymour model. What is nice about this model is it's going to come with all the different pressure injuries that you're going to hopefully, or that you should encounter when you're dealing with patients. So starting on the model, on this side here, we're going to have our stage 1. On this side, we have our stage 2 pressure injury. On this side over here, we have our stage 3. What's nice on this stage 3 is it does have a couple of additional features. It does have some undermining on the top, as well as a little bit of tunneling on the bottom of the wound. Coming up to the main portion of the model up here, we have our stage 4. This is going to have a lot of undermining here, tunneling, and then exposed bone. In addition to the stage 1 through 4, we do have 3 additional wounds. Starting with on this side here, we have our unstageable. This is going to have the slough covering the wound bed, and then it also has some eschar on the side. On the other side of the model, we're going to have our deep tissue injury, and then a large surgical dehisced wound. So all of those wounds are present on the model. You can go over what each wound is, why you would stage it, that wound, and kind of the ins and outs of what can cause that. On this large stage 4 here, as well as on the stage 3, I mentioned the undermining and the tunneling. What's nice on there is there's going to be different degrees of how much is there. So especially on this undermining on the stage 4, you can go up quite a bit. You can see a lot of my finger can get up in there. And then as we look into the tunneling down here, this tunnel is quite deep. I'm going to have to use something like a Q-tip to go all the way down to the bottom of it. And as I pull that out, you can actually see how deep that goes. So what's going to be nice on that is that people can actually learn how to measure that and get the correct depth of that. So those are all the different wounds. How are people using this model? That's a question we get a lot. What can you do on it? So the first thing they're going to do is kind of what I already went over with you. How do you go over the different wounds? How do you identify them? Pointing out features of the wounds or what might make it a stage 1 or a stage 3 or a stage 4. So if I'm teaching, I can go over all of that with the students that I'm dealing with, whether they're in nursing school or the hospital setting. And then after I've gone through all the different wounds, you can ask the students to maybe look at a wound, whether it's on this model or in a picture, and they can do the same thing. They can say, hey, that is a stage 4. I know it is because it has bone exposed, or whatever the feature might be. The other thing that they can do on a model, which can be really helpful, is learn how to properly measure. And I kind of went over a little bit of that with how deep the tunnel was, but you can do that also for the width, the length, or the depth of any of these wounds, measuring how deep that tunnel goes, how deep the undermining goes, and that can be really important so that everybody is measuring consistently from one person to the next, from one shift to the next, and that when you're charting or seeing how that wound is progressing over time, everything is going to be accurate. So we get that a lot. The next thing you can say is, well, how would you treat this wound? And so if I'm the student and I'm in there and I'm going to be treating, whether it's the stage 1 down here or the stage 4 up here, I can say, I would treat it this way. And if the instructor is there, they can either agree with me and say that's a great idea, or they can maybe give me another idea and explain why that might be a better option than what I had proposed. After I've gotten the go-ahead and I know how to do this, I can go through and show whoever it is that's instructing me that I know how to actually put that into practice. So if it's negative pressure, you can use negative pressure on any of these models, whether it's the Seymour Light or the Dark. You can go ahead, you can fill your wound bed. We'll talk about the stage 4. You can fill that with your foam or your gauze. You can put that in, make sure that it's filling the undermining, and then you can put your clear dressing on top, attach whatever negative pressure system that you're going to be using on there, and then turning it on, making sure you get a seal. What's nice about this is it gives you the opportunity not only to ask questions as you're going through the application of the dressing, but it also allows the instructor to give you feedback. So if you're at a patient setting where I'm working with an actual patient, I'm going to be less likely maybe to stop and ask a question if I'm unsure what I'm doing. And it also isn't the best opportunity for the the instructor to maybe stop and give you feedback as well. Where in this setting here, there's no patient there, there's nothing that should make you feel uneasy. You can actually stop, go over things, correct what you're doing, and then continue on knowing what you now know. So again, negative pressure on the stage 4, negative pressure on the unstageable on this side, negative pressure on the dehisced. What's nice on this one here is that if you do apply negative pressure to it, the wound will actually close a little bit. It'll start to reapproximate those edges. It's not gonna put them all the way together, but you will see a little bit of movement just like you would on an actual patient. On the other wounds or on these, you can also put in either gels or ointments or other bandages. So on the stage 2 or the stage 1, you can put another bandage on there that maybe is just to keep it clean or to help offload some of the pressure. The only dressings we recommend that you don't use on here is anything with silver in it. There are some silver dressings out there. There's some silver ointments. We have tried those with this material and they will stain the material, so don't recommend that. But any of your other negative pressure dressings or ointments that we've tried should work just fine. But if you do have any questions, feel free to reach out to us. We either have an answer or we'd be happy to test it for you if it's something that we haven't tried in the past. So that's kind of the use of the model. Again, really helpful for people to learn. And again, we see people using this in various settings. The first one's gonna be nursing school. You're usually gonna be using it as more of an overview in that setting. It's not gonna be going into a lot of depth, but it's a great thing to give people some exposure to it. In the hospital setting, what can be really good with this model is going over with people that are either going to be around patients that could or will have pressure injuries, or for somebody that's going to be getting into wound care. So if it's a nurse that's saying, you know, wound care is something that interests me, this can be better to go maybe in a little deeper dive and go into it. The other thing that can be good for this is actually dealing with patients or their family. So if a patient is at high risk for developing a pressure injury and they're going to be sent home with specific care instructions, one, if they have to change a dressing at home for whatever reason, they can be shown how to do it on this or some of our other wound care models. The other thing can be do is to ensure compliance. So if you're telling a patient, hey, you need to get up and do this, or you need to, whatever it might be, you can go over, this is why we want you to do it, because this is what can develop if you don't follow it. You are at high risk for a pressure injury. This is what they can look like. And sometimes that can have a better impact with that patient. So the last thing I kind of want to go over is kind of some of the big questions we get. The biggest thing is, can we use negative pressure on it? Like I already mentioned, yes, you can. Any of the negative pressure systems that are out there can be used on it. And in fact, many of those companies use our models to demo their negative pressure systems. So any of them can work. Can you use all dressings? Yes. Again, like I mentioned before, don't use silver, anything with silver. That will stain the model and that will not come out of the material. We've tried and there's nothing we've found that will get it out. How long will the model last? That's a really big question we get. The model will last for a really long time. It's hard to give an exact age on it, but we do have customers that have had these models for up to or more than 10 years and they are still working fine. The biggest thing is going to be to care for the model and not be overly rough with it. When I say that, biggest things you can do are when you're done doing a demo, remove any of the dressings that you placed on the model, and if there's anything on it that's dirty, clean it. We see some company reps, and the big thing we see with them is they'll do a demo, they'll put a dressing on there, they'll throw it in the trunk of their car, and it'll sit in there for sometimes days or even weeks in between uses. And that can be really hard on the model with the adhesive stuck to it, especially if it's somewhere where it's warmer out and it's kind of baking in a trunk. Is there anything that will damage the model? Like I mentioned, silver will do it. The other thing is going to be ballpoint pen. Don't get that on here. It's very difficult or impossible to get it out of the material. And then general cleaning. So the best thing you're going to want to do, soap and water, clean it if it gets dirty, if it's just dirt, grime, clean it off soap and water. You can also use isopropyl alcohol. That does a great job of not only cleaning off dirt and little bits of adhesive, but it'll also just kind of make the surface clean and make stuff stick to it really well. Another thing is, what do you do if the adhesive is on here and stuck a little bit more aggressively? Maybe you haven't taken the best care on it and you need to get it to be really clean and it's stubborn adhesive. For that, I'm actually going to recommend something like this. This is Goo Gone. There's also like Goof Off. There's a whole bunch of them that are very similar in name. You can use any of these types of products. what we would recommend is take a paper towel or a clean towel, spray it really well or soak it really well with one of these adhesive removers. You can get them like at Home Depot or your local hardware store. Soak it really well, lay it on top of the portion of the model that has the adhesive buildup. Let it sit for 5+ minutes. After that time, give it a really good wipe. Most or all the adhesive should come off. If it doesn't, repeat that process until it does. The most I've seen is 2 or 3 times, and that's for something that's really, really dirty. That should break down and get all the adhesive off of the material. After that, you're gonna wanna clean it really well, probably at least 2 good wipes with isopropyl alcohol. It's gonna remove an oily residue that's left behind by all of these adhesive removers, and that's gonna allow the dressings to stick again. So those are kind of some of the main questions. The one last thing we do get a lot is, I have that model, I think, but it doesn't quite look like that. And there's 2 different things that could be. One is, there are a couple of models that look similar to ours that are sold by other companies. I don't remember their names, but if it says Seymour on it, on ours, it's gonna say it at the bottom here. If it says Seymour, that's from us. It could be sold by somebody else, but it was manufactured by us at Vata. There are other models, again, I can't speak to those models because I haven't used them personally, but this is the only model that is actually manufactured by Vata. The other thing though, it could be is an older version of this model. We did do a previous version, our original version. That one there, it's gonna be a little bit shorter. We extended it when we redid the model. And the other big things that you're gonna notice is gonna be the stage 4 here. On the original model, it was like a little triangle, kind of like that shape, and it was very shallow. The bone was also completely flat. So if you do have that model, that was made by us. That model was discontinued, that was about 14 years ago, 15 years ago. And so if you did have that model was pre-2008, and we switched away from it to make the wounds look more realistic, as well as changing the material the model is made out of to have it hold up to bandages sticking a little bit better. So like I said, it does come in the light and the dark. This is our 920 model, this is our 910 model. Both models are gonna be the exact same as far as the wounds that are on them. They're gonna be the exact same on use and care and pricing. But if you do have any questions on any of these models, feel free to reach out to us. We'll put our contact info at the end of this video, and thank you for your interest.